गुड इवनिंग एवरीवन। am I audible? क्या मेरी आवाज आ रही? So dear friends, first we are starting the session in English for 30 minutes. Then we'll do the recap in Hindi for the same. पहले हम इंग्लिश में सेशन स्टार्ट करेंगे आधा घंटे का, और फिर उसी का रिकैप हिंदी में किया जाएगा. So let's start this session and we are discussing tongue diagnosis. Tongue diagnosis has been mentioned in the Ayurveda and TCM both. And tongue can be decided in three parts. This is the upper part, which is doing the representation of upper body. This is the middle part, doing the representation of the middle body. And this is the lower part, doing the representation of lower body of the human. Okay. So while looking the tongue, we can find out the problem, ailments, changes, if they are happening in the body. So this is the Ayurveda tongue diagnosis, and this image is the mirror image. Okay, so we have divided the tongue in three parts. So we can see both the lungs in the upper part, liver and spleen in the middle part, and the right and left kidney in the lower part. We already discussed this image yesterday. And this is the TCM concept of the tongue diagnosis. As per the TCM concept, the tip of the tongue is doing the representation of heart, and the near about 1 inch area, which include heart, is doing the representation of lung. The central part doing the representation of the central body means earth element or spleen and stomach. And the side is doing the representation of liver and gallbladder. And the root of the tongue, which is the very important, doing the representation of kidney, bladder, and intestine. We already discussed yesterday. So we are just going through. Now, when we talk about the normal tongue should have good spirit. Normal tongue should have good tongue color, the very good shape, and the normal coating, and the enough moisture. Then we can declare that this tongue is normal. Because when we do the diagnosis, so first we should know what is the normal tongue. Then only we will be able to do the diagnosis. So when we see the first point, the spirit of the tongue spirit. So if we see, mainly we have to see this root part of the tongue, because the root part of the tongue is the part of kidney, the part of the lowermost part of the human body. This part belongs to the uterus, prostate, genital part, urinary bladder, and mainly this part belongs to the kidney or water element. So the person having good kidney essence, the person is having good energies from the birth, or even after the birth, person is able to save the energies by not wasting the energy in unwanted, like getting up in the night, doing irregular food habits and all. So if we see the root of the tongue is doing the representation of spirit. So tongue is spirit. Okay. So we have to see the tongue, the complete tongue. We have to see the first part of the tongue. If it is good, really, it's a very good. We have to see the second part of the tongue. We also have to see the third part of the tongue, but the third part is most important if we want to see about the spirit. Okay. So if this part is vibrant, alive, so we can tell this person is vibrant and alive. Okay. So the last part of the tongue is most important. So this is the first point. When we are looking the tongue, first we are looking the vibrant tongue, the live tongue, and the spirit of the tongue by looking the part 1, 2, and 3, but most important is the part 3. Now the second is tongue color. Tongue color play a very important role. The normal tongue means pale and red, means normal pale and normal red. So the pale color is the result of fluid And the red color is the result of blood, because we have fluid in the tongue as well as blood in the tongue. So fluid is giving the pale color and blood is giving the red color. So normal tongue means having normal pale and the red color. Suppose if tongue is not at all having the pale color, it means the fluid is not enough. The fluid is not enough. So this is the diagnosis we will able to see. And we know what is pale color. Okay. So if we see the tongue color, tongue should be pale red and fresh. Generally, tongue has been told the gate of heart. So tongue is the gate of heart. If your heart is good, supplying a good blood to top to bottom, each and every part of the body. If heart is supplying good blood to each and every part of the body, then your tongue will be enough red, which is required. Tongue will be enough red. So the red tongue, so that your heart is good, your heart blood is good, and heart is supplying a good blood throughout the body, including tongue. So your tongue is red. And whatever the fluid, whatever the pale color. So when we talk about the stomach play a very important role in the human body. When we are eating something, it is going in our stomach playing a very big role. And stomach is the main organ to supply the fluid to the tongue. Suppose you are taking antibiotic. So antibiotic going and creating too much heat in your stomach, then it will reflect in your tongue and mouth. You will feel the too much dryness in the mouth and even too much like decrease of moisture over the tongue. So fluid is the result of stomach. If there is too much heat in the stomach, whether because of the antibiotics or because of your irregular food habits, or maybe you're eating too much spicy food against your constitution, so stomach will get disturbed, and stomach will get disturbed immediately. You can find out from the tongue, because the normal pale color is the color who is coming from the stomach. Okay, so while looking the tongue, we can immediately find out this tongue is good, red color. Okay, it means heart is good, heart blood is good. Second, this tongue is having good pale color, means even stomach is working very nicely, right? So the normal tongue means the tongue which is having red plus pale color, right? And red color showing the good heart blood, and the pale color is showing the good stomach fluid. We will also see some more example very soon. So coming to the next. So third, we are looking the shape of the tongue. So normal tongue should be in the very good shape, like it should come out straight. But sometimes we see the tongue is coming out in the deviated form. Sometimes we can see swollen and deviated tongue. So if the tongue is swollen, if tongue is deviated and not in the shape, it is also showing disharmony. For example, when the person is getting deviated tongue, it may be normal disease and it might be very bigger disease. So I will give you the example of one normal disease and one bigger disease. The deviated tongue. As soon as you see the deviated tongue, it is showing the air is plus plus in the body, or the wind is plus plus in the body. So the person might be having too much wind in the body, not only in the tongue, not only in the upper part. The tongue is doing the representation of whole body. So there is a too much wind or too much air in the body. So if too much wind, it also might create paralysis. This is the bigger problem. And what is the normal problem? The normal problem is this person might be having too much wind in the head region. So might be having headache only. So as soon as you see The tongue is not in the shape. You have to take action and do accordingly. So before that, you should able to find out what is the exactly problem, and then only you are able to treat. Okay. So the third thing, we should be well aware about the shape of the tongue. Now the fourth thing, and very important thing, the coating of the tongue play a very important role. Like you can see here, some tongue is having pale coating. If you see here, this tongue is having yellow coating. This is the yellow. In this tongue, you can see the coating and as well as the pigmentation, dark color pigmentation. And here you can see the black color as well as the yellow coating here. So this is the like a astrologist seeing your lines in the palm and doing the declaration about your past, your present, and the future. While looking these tongue, we can find out what is exactly problem there. Yellow color is the color of heat, right? Dark color means circulation is not enough. Circulation is stuck and there is no circulation. Like we can see, if water is not flowing in the canal, then the water will be becoming black day by day, and there will be lots of fly, mosquito will come, and lots of dirtiness will come, and the blackness will come. In the same way, when you see the black tongue, it's so the energy is not flowing, it is blocked in the canal somewhere. So we have to remove the stagnation blockages. Yellow tongue showing the heat. In this way, we can find out. So the coating is very important role, playing a very important role. So we should find out what is the coating of the tongue. So this is the point number 4. And the point number 5, moisture over the tongue. So we can see this is the tongue looking like having some moisture. Some tongue are very dry. So when we are doing the tongue diagnosis, always we are focusing in these 5 things. Number 1, the spirit of the tongue, especially the root of the tongue. Number 2, color of the tongue. Number 3, the shape of the tongue. Like we see deviated tongue is might be the sign of paralysis. The tongue coating, like the yellow coating, is the sign of heat. And the moisture of the tongue, it should be normal. So always a healer, a expert physician checking these 5 things, then doing the declaration about the diagnosis. Just do not give the declaration just while looking the only single point. So when we see the tongue, this part all around the tongue is doing the explanation of exterior. And this part is doing the explanation of interior. What is the meaning of this? What is the meaning of exterior? And what is the meaning of interior? The meaning of exterior. Suppose you are walking around, and under the cold air. And this cold air is attacking in your body. So this is creating the disease. This is called exterior because cold air is attacking in your body. So something is attacking in your body. Take another example, like you are suffering with the flu. Why you are suffering with the flu? Because some virus is attacking on your body. Okay, so like the COVID-19, some virus is attacking on your body from the outside. So this is the exterior, means you are getting the disease because of the factors available around. That is called exterior, right? And what about the interior? The meaning of interior, everything is found fine around. You are sitting very calmly, but inside your mind, you are having too much anger. Maybe you are standing up with the anger, throwing the object here and there. So this, your actions is coming from the inside and creating the problem, and that anger might increase your blood pressure. That anger might create the heaviness in the head or the headache or the migraine, or even the other emotions like the fear. If you are in the fear is coming from the inside and creating the disease. So these factors are called interior. So outside of the tongue is exterior and the inside of the tongue is interior. So these parts, so in this way, we are finding out whether the problem is coming from the outside, whether we have to create the good defense system so that there is no further attack, or nothing from the outside, everything is coming from the inside. So we have to work on the inner body itself. So tongue is showing, it's a very simple, like look at the tongue. If the problem around means outside, if the problem in the middle, deeper inside, so it is from the inside. So now let's see few factors before doing the tongue examination. When you do the tongue examination, so we should always do the tongue examination, prefer a daylight. Always prefer a daylight, because daylight you can see the tongue very nicely. Okay, so if you are in the room, see the tongue where you have window and the sunlight is coming properly, and avoid seeing the tongue in the artificial light. But suppose you have to see the tongue in the artificial light, then you should have good light. Okay, you should have strong light. So prefer natural sunlight. It will give you very good picture. Otherwise, you should have good light. In the dim light, you will not be having good idea, enough idea. So remember this. Okay, so this is the first step we should follow during the examination. The second step, remember this is a very important factor, the factor of 15 seconds. When you're telling the patient, so your tongue out, tell the patient only for 50 seconds, because many persons are having very stiff body, and if you tell them to take the tongue out, if you are bringing the tongue even for 30 seconds, they might be having pain in the jawline, in the jaw, on the mandibular joint, and even sometimes they might feel the difficulty to take the tongue back in. So you can tell the person, and you tell the person, okay, bring your tongue out, just see the tongue, whatever is possible for you in the 15 seconds. But in this way, you can tell the person many times. You can see the tongue 3 times, 4 times, 5 times, as much as you are not able to reach on the diagnosis, but at a time, not more than from 15 seconds. The second cause, if the person is bringing the tongue out more than 15 seconds, then tongue will becoming red automatically, because there will be more blood circulation if the person is hanging the tongue more than 15 seconds. So if there is a more blood circulation will appear in the tongue, then the natural color will disappear, then we might do misdiagnosis, we might do wrong diagnosis, right? So in this way, tongue out maximum for 15 seconds, and you can see tongue as many times as you need, but do not exceed the time more than 15 seconds in one go. Otherwise, the person might feel difficulty, person might feel pain, as well as the color of tongue might change, right? Now, there are many persons, they are eating the tobacco, pan very regularly. So this is a very important information. If the person eating very spicy food, okay, so when the person is eating spicy food, the tongue will become red. So the person is coming eating the spicy food. Now you might do wrong diagnosis, because tongue will be looking like red. Spicy food create more circulation in the body as well as the tongue. So make sure for this factor. The factor number 2, the person eating pan or tobacco or wattle leaves with lots of masala inside, you will not able to get the real picture. So always make sure for this point. The third factor and very important factor, when the person smoking or eating the tobacco, then as soon as person smoke or eating the tobacco, there will be yellow coating arise over the tongue because of rising of the heat in the body. So as soon as person is smoking, there will be yellow coating on the tongue, or eating the tobacco, there will be yellow coating on the tongue. Even person will spit out, but the post effect will be there and there will be yellow coating, right? So in this way, if we want to see the tongue for the person who has just have taken the cigarette or eaten the tobacco, then give the break for minimum 15 minutes to 30 minutes and then see the tongue till the person becoming absolutely normal, natural. So these are the few factors we should always take care. Otherwise, we will, whatever reading we will get, it might be wrong. Okay, the very important factors about the antibiotics. The person taking the antibiotics will develop the patches over the tongue. Why the person developing these patches over the tongue? Because antibiotic going in the stomach, and because of the heat of the antibiotic, there is a burning in the stomach. Burning in the stomach, there is a heat in the stomach, and it will make the stomach deficient. Stomach will not able to supply the proper fluid to the tongue, and there will be development of the patches all around the tongue. So when you see these types of tongue, there are lots of patches over the tongue. It might be results of antibiotic. Even I have seen many patients, because in the last 2 years, there are too many patients suffered with the COVID-19. And after getting recovered, even they are having lots of post-COVID myalgia, the pain all around the body. So when the person is coming to us, doctor, now I am absolutely okay, there is a no anything like a COVID, I am recovered fully, but still I am having too much weakness in my body, still I am having pain in my body, now what to do? Then we are telling, okay, show your tongue. And we are looking these patches. It means because of the medication of COVID, because of the medication of any antibiotics, there is a deficiency of stomach yin or stomach fluid, which is creating patches over the tongue. And what is the result in the body? The person will be feeling tired all the time, and sometimes burning in the stomach, and dryness in the throat, and pain in the body. So if you want to do the treatment of post-COVID myalgia, post-COVID complications, you improve the stomach, because the medicines warning the stomach, creating heat in the stomach and drying the stomach, doing the deficiency of the stomach yin. And this is the treatment of post-flu and any disease where we are taking the antibiotics. Now, regarding the steroids, when we are taking steroids, and steroids are very common nowadays. If you are suffering with any problem and which is challenging for the medical doctors, so they will immediately give you steroids. Like if you are suffering with a rheumatoid arthritis, you will be on the steroids. If you are suffering with the joint pain, which is not curable by any medicines, again, doctor will put you on the steroids. If you are suffering with the asthma, doctor might put you on the steroids. There are too many diseases, doctor will put you on the steroids. So many person are taking the steroid for 1 week, 2 weeks, 3 weeks. Okay, no problem with them. But sometime what happened? Person are taking steroid year to year. We are asking, okay, till how long you are taking the steroids? Doctor, I'm taking steroids since 5 years, 10 years, 15 years. It is really very harmful. So we can see the effect of the steroid all around. If we see the face of the person taking the steroid, there will be swollen face. And if we see the tongue, there will be swollen tongue. So steroid creating swollen tongue as well as the swollen face. Okay. So how to treat this person? Definitely we are having very good points. And with the help of some points, we can reduce the effect of the steroids. And this is the beauty of tongue diagnosis. Just by looking the swollen tongue, we can tell the person this person is doing something against the immune system, because this is your immune system. This is your immune system, and this is the steroid. So they are fighting with each other. So what is the meaning of steroid? The meaning of steroid, they are just against your immune system. They are fighting with the immune system. So when you are doing something with yourself, which is just against your immunity, it will develop swollen tongue. So swollen tongue means we need to work on your immunity. So tongue will be red and swollen because of the intake of steroids. Now, it's a very common taking the bronchodilator. Even there is uncountable patients of allergic asthma, bronchial asthma in India and all around the world. So when the person taking bronchodilator regularly, the bronchodilator also contain lots of steroids, because the bronchodilator, like the histamine, bronchodilator are killing the histamine, they are antihistaminic, or we can tell they are also one type of steroids. So if the person is taking bronchodilator, then tip of the tongue will become red. So the tip of the tongue also showing the person is taking something against, like person is taking something, some medicine like the steroids, and the tip of the tongue red is showing the person is taking something against the lungs. Okay, so this is especially the red tip of the tongue might be showing many things, and one thing, person is taking the steroids or person is taking the bronchodilator. Okay, so now let's discuss about the stomach deficiency. Just I told you, if someone is taking the medicines or someone is taking the medicine for flu or suffering with some bacterial infections and taking the medicines, then this medicine going in the stomach, and this medicine creating too much heat inside the stomach. And because this medicine creating too much heat inside the stomach, so this create stomach fluid deficiency, or in the other word we can tell stomach yin deficiency. It is same like thing, if sun is around, it will evaporate the water. So if heat is too much in the stomach, it will evaporate the water and there will be dryness in the stomach, there will be fluid deficiency in the stomach. Then what is the result? The result will be there when there is a stomach deficiency. The first sign, the person as soon as get up in the morning feel tired. So you have slept for overnight, now you are getting up in the morning, you should get up fresh. But as soon as you are getting up in the morning, you are getting up very tired. It is a sign that you are suffering with stomach deficiency. You might have taken antibiotics long back, or you have might taken something wrong in your food, and which has created this problem. So the person will having no appetite or the very poor appetite, okay, and don't want to eat anything. And definitely there will be constipation and the little burning in the stomach, dry mouth, throat, especially in the afternoon. Just want to drink the water, small sip. Okay. Even the person eating very little and feeling too much distension in the abdomen. So these are the signs of stomach deficiency, and why it's happened because of the intake of antibiotics. Right. So let's see how to do the treatment of this. So in the acupuncture, we will see how to do the treatment for this. So first I would like to take you naturally how to treat the stomach deficiency. So in the Ayurveda, it has been told you can take dhanya panchak. So dhanya panchak means there are 5 things. Number 1, coriander. Number 2, cumin. Number 3, dry black grapes. Number 4, rock sugar. And number 5, fennel seed, 1 teaspoon, 1 teaspoon as per taste, 1 teaspoon, and the dry black grapes is 20 grams. Dip all the things in 1 glass water in the night, and in the morning you can mash them very properly and have it in the morning just for 21 days. Taking 21 days, this thing is enough to cure your stomach iron deficiency. So this is given in the Ayurveda. As per the Ayurveda, when you are taking something which is very hot for your stomach and which is also creating burning in the stomach and creating disharmony in the stomach, so with the help of this dhanya panchak, we can improve it. So there are 5 things. That's why it's called dhanya panchak, means the 5 important things. So first is coriander or dhania, second cumin or jeera, third dry black grapes or kali draksh or the munakka, rock sugar or the mishri, and the fennel seed or the soft bariali. So take everything 1 teaspoon, but the dry black grapes can be taken 20 grams and rock sugar can be taken as per taste. So dip them in the night in the 1 glass water, mash them in the morning properly and drink the water. This is wonderful. Okay, this is as per the Ayurveda. Suppose if you don't want to do this all, just take the third number ingredient, that is also enough, that is called black grapes. So even you can take the dry black grapes 20 grams, soak them in the water, 1 glass of water in the night, and have it in the morning, and this will also improve your stomach yin. So right, in this way, this is the first thing which can cure your stomach yin deficiency. Now let's talk about the second thing. As per the acupuncture, what we can do. As per the acupuncture, now the second treatment I would like to suggest you here. There are 3 points as written here: spleen 6, stomach 36, and CV12. There are 3 points. These 3 points are very wonderful for stomach yin deficiency. So I would like to tell you, stomach 36 and CV12, also called energy point. Energy points. So when someone, and also called like these points are improving the energies. So we are telling the energy point, enthusiastic point, and if we are stimulating these points increasing our digestion, appetite, and removing the yin deficiency. So I would like to show you the image of all the 3 points: spleen 6, stomach 36, and CV12. So we'll go through very quickly here. Fine. So first I would like to show you the location of here, the stomach 36 point. So we can see the knee. This is the knee joint. And from the knee eye, we can see there is a natural eyes of the knee. We are having 2 eyes in the knee. Okay, they are called knee eye. From this knee eye, if we go 3 chun down, 3 chun is equal to 4 finger. So from the knee eye, if we go 4 finger down, we are reaching on the stomach 36. So stomach 36 is very good point. We can put in the body, or we can put in the sujok, means in the hands. So this is the first point. So just you have to remember 4 finger or 3 chun below from the knee eye. It's a very good point. So just by stimulating this point, you can work on the stomach. Now I would like to show you the point number 2 here. So the point number 2, again, now look at the feet. Now this is the medial malleolus. Look at here. This is the medial malleolus. So from the midpoint of the medial malleolus, again you have to go 4 finger up. 4 finger up. So this is the location of spleen 6. So we can tell 4 finger up or the 3 chun up. So this is the location of spleen 6. And this is the next point, which is very good. improving the stomach. I would like to show you the same point once again. So again, we have just chosen the point forefinger up. So this is the forefinger formula is very nice. So let's see once again here. So if see the this is the medial malleolus. From the midpoint of the medial malleolus, if we are going forefinger up, on the border of bone, we are having spleen 6. So we can tell it is also 3 chun up or the 4 fingers up. We can treat with the help of this. So we have chosen 2 point, stomach 36 and spleen 6. Okay. Now the third and the last point, which is also very important, which I would like to tell you, CV12. So now coming on the stomach, coming on the abdominal region, look at the abdominal region. So look at from here. So this is the navel region, and this is the last part of the bone. This is the last part of the bone that is called sternum bone. So from here to here, this part is very important. And we can do the imagination of whole human body here. So this is the head region here. These are the 2 arms. This is the chest. So just to do the imagination of whole human body here. Whole human body here. So this upper part doing the representation of brain, the middle part doing the representation of digestive part, and the lower part is doing the representation of genital part. So what I want to tell you, my target is treating the stomach. So I will go in the middle part. So what I will do, from the navel till the last part of the sternum bone, just I will take the midpoint here. The midpoint is doing the representation of the stomach. The upper point will be doing the representation of brain. The lower point will be doing the representation of genitals. So I will take just a midpoint, which is called CV12. Even if you want to measure with a finger from the navel region, if you go 6 finger up, you will reach on the CV12. So CV12, just a midpoint here or the 6 finger up. So as per the acupuncture, we are telling it 4 chun up or the 6 fingers up. Okay. So both all the 3 points we can put in the sujog as well as in the body. So this is the another option. This option is good for the person who is doing acupuncture practice. So we have seen the two treatment methodology. Number 1, why Ayurveda, and number 2, why acupressure or acupuncture. So acupuncture. So we have seen 2 methodology. What I want to tell you, if you know that you need to treat the stomach, now you have to apply whatever you know. You can apply the Ayurveda, you can apply the acupuncture, because just you need to treat stomach yin deficiency. Even you can do the naturopathic treatment, tell the person, take lots of fruit early in the morning, because fruits are also reducing the stomach heat. Avoid all the spicy food, take the normal and proper sleep. In this way, if we are able to treat the stomach yin deficiency, we will remove the effect of antibiotic and patches over the tongue. So this is the beauty. Just by seeing the patches, we can declare this person has taken the antibiotics and treatment is stomach yin deficiency. So I would like to tell you what is yin. The meaning of yin is fluid of the body or the air condition of the body. So what we have to do, we have to increase the fluid, we have to increase the cooling effect in the body. Because of the heat effect of the medicine, there is too much heat in the body, it is reflecting over the tongue. So enough for today. Now we'll conclude the English session now. अब हम इंग्लिश का सेशन समाप्त करते हैं, 2 मिनट का ब्रेक करते हैं, फिर हम हिंदी में रिकैप करेंगे और हमारी कल भी क्लास होगी. We are also having class tomorrow, so you can join the class tomorrow, and then after the class will be only for enrolled participants. तो कल की क्लास भी आप ज्वाइन करने के लिए वेलकम है. All of you are welcome to join tomorrow class. Then from the next day onwards, we are doing this class only for enrolled participants, because this tongue diagnosis is very deeper science, very long science, and as per my plan, we have to do the many classes, I think more than 30 classes. जब किसी को डायबिटीज होती है तो डायबिटीज के भी 3 पैटर्न होते हैं, अपर टाइप की डायबिटीज, मिडिल टाइप की डायबिटीज और लोअर टाइप की डायबिटीज। अपर टाइप की डायबिटीज लंग्स के कारण होती है, मिडिल टाइप की डायबिटीज स्टमक से होती है, पैंक्रियास से होती है और लिवर से होती है, और लोअर टाइप की डायबिटीज किडनी के कारण होती है। तो अगर किसी को मिडिल टाइप की डायबिटीज है, उसका गला सूखता है और उसके अंदर स्टमक यीन डेफिशिएंसी के लक्षण हैं, तो हमें ये पॉइंट से ट्रीटमेंट करना होगा। तो डायबिटीज के 3 पैटर्न में से एक पैटर्न को पहचान कर फिर आपको ट्रीटमेंट करना होगा।